Hello, my name is Erin Higgins and I'm an OBGYN generalist in the Women's Health Institute here at Cleveland Clinic. Today I will be presenting our poster titled Simulation-Based Training Program in Outpatient GYN Procedures for Advanced Practice Providers. My co-author on this poster is Denise Weber, a certified nurse practitioner in our institute. Advanced Practice Providers, or APPs, provide full-spectrum OBGYN care in the outpatient setting. In the Women's Health Institute at Cleveland Clinic, these providers include certified nurse midwives, nurse practitioners, and physician assistants. Many APPs also perform minor office-based gynecologic procedures, such as endometrial biopsy. Such procedures require semi-annual credentialing in order to maintain clinical privileges. Traditionally, the credentialing process has been accomplished with real patients in the clinical setting amid an often busy office schedule. This relies on both supervisory physician availability and the frequent occurrence of patients who need specific gynecologic procedures. To improve the educational experience and minimize impact on patient care, we created a simulation-based training program to provide observed skills practice for APP credentialing in several outpatient gynecologic procedures. This poster will review the structure of our training course, highlighting the areas that contribute to its success. Our learning objectives were as follows. After completion of this training session, the APP will be able to identify indications for 4 gynecologic procedures, correctly perform the procedures without immediate complication, educate patients regarding post-procedural care, and demonstrate correct use of personal protective equipment, or PPE, and sterile technique. We developed a hands-on simulation-based training session for office-based gynecologic procedures. The selected procedures have included vulvar biopsy, cervical polypectomy, incision and drainage of a Bartholin gland abscess, and endometrial biopsy. The training was conducted at the Simulation and Advanced Skills Center. Prior to the hands-on training, learners participated in a didactic overview of the material. Each procedure was covered in detail, including indications and contraindications, list of supplies needed, a step-by-step review of the procedure, including video, and post-procedure instructions. During the hands-on training, instructors were present to observe participants as they performed each procedure. One physician instructor was present to sign off on the credentialing sheets. For each procedure, participants were expected to counsel, obtain consent, and perform a procedural timeout, position the patient appropriately, demonstrate correct use of PPE and sterile technique, perform the necessary steps of the procedure, and provide post-procedure and follow-up instructions. To date, we have held 3 simulation-based sessions at the Simulation and Advanced Skills Center, training a total of 24 APPs. Overall, the training program has been very well regarded, with participants demonstrating increased clinical competence and procedural knowledge immediately post-training. Surveys were distributed asking participants to evaluate the training on a 9-point Likert scale. Results for our training were quite favorable, with participants ranking each aspect between 8 and 9, which corresponds with outstanding to exceptional. Comments from participants have included, my instructors were helpful and attentive, I was able to learn and enhance my skills through this hands-on simulation, this was hands-on and questions were answered on the spot. APPs have been increasingly utilized in the field of OBGYN over the last few decades. With the increased demand for outpatient gynecologic services, patients often find themselves struggling to obtain care in a timely fashion, and this is especially true of complaints that require office-based procedures. APPs play an integral role in helping to fill the gap created by a nationwide shortage of OBGYN physicians. Constraints of the clinical setting, however, prevent easy access to and maintenance of privileges for outpatient gynecologic procedures. This highlights the importance of simulation-based training programs focused on gynecologic procedural competence. As a result of our simulation-based training, we have provided APPs in our department the skills necessary to provide gynecologic care to a variety of patients in the outpatient office setting. Our curriculum provides a standardized environment for deliberate practice while reducing risk to patients. Additionally, this program promotes interdisciplinary collaboration, bringing together diverse learners and instructors. Future steps include obtaining IRB approval for data collection about participant confidence and maintenance of skills after training. We also plan to expand the program to include additional skills training such as IUD insertion. This concludes our presentation. Thank you for your time.